I'm Kira.
Candace.
Megan.
And I'm Katie. Would you like your pet to be tested on? I know I wouldn't. I love my doggy very much. According to Procon.org, the U.S. Department of Agriculture reported in 2010 that 97,223 animals suffered from pain during experiments while be given no anesthesia for relief. According to William Pissell, almost 95% of research animals are not covered by the Animal Welfare Act. The majority of animals are euthanized during or after experiments. The Animal Welfare Act should cover all animals and restrict testing on them. Biomedical research on animals can hurt animals. Cultivated skin cell testing is an alternative to animal research. According to Procon.org, artificial human skin, such as the commercially available products, Epiderm and Thinsert is made from sheets of human skin cells grown in the test tubes or plastic wells and can produce more useful results than testing chemicals on animal skin. In vitro testing, which is in-glass testing, such as studying cell cultures in a petri dish, can produce more relevant results than animal testing because human skin cells can be used. There are many other alternatives to animal testing. According to Neves.org, these are computer models and simulations, computerized patient drug databases and virtual drug trials, and microdosing. Microdosing is where the human is given a very low quantity of the drug so that it can be tested for the effects on the body on a cellular level. Biomedical research on animals wastes time and assets. Testing on the animals costs a lot of money. According to Procon.org, an unscheduled DNA synthesis animal test costs $32,000, while the in vitro alternative costs $11,000. I would say I'd do 3 in vitro tests versus 1 animal test so that you get more results for the same amount of money. Animals and humans also react differently to different medical issues. According to William Pissell, a reliance on mice in medical research has been potentially useless for 3 major, often fatal conditions: sepsis, burns, and trauma. Also, this was concluded from a 10-year study that was worked on by 39 scientists from across the country, and it reports that human and mice respond to inflammation completely differently. According to Procon.org, 94% of drugs that pass animal tests fail in human trials. Also, the anatomic, metabolic, and cellular differences between animals and humans make animals poor models for human beings. The fact that humans and animals react differently to so many different medical issues causes scientists to ignore possible treatments and cures for humans. According to Newsweek, even if a new chemical entity is deemed safe at the animal stage, it only has an 8% chance of being approved for human use. Biomedical research on animals should be restricted. It will save lots of time and money, and less animals will suffer. This plan will work for a number of reasons, including that animals will not suffer as much and companies will not want to risk their reputation on doing something that's illegal. Animals are sweet, loving, innocent creatures, and we are harming them by testing on them. The Animal Welfare Act should cover all animals and restrict testing on them.